Cataract surgery is one of the most satisfying surgeries amongst all the surgeries in the body. Now, majority of the patients after the cataract surgery are quite satisfied, but there is a small percentage of patients who, in spite of having an uncomplicated surgery, have certain symptoms or problems which causes a lot of dissatisfaction amongst them. So let us try to understand them one by one, try to classify the issues and try to understand how these are addressed. Now these can be divided into three broad groups. One is vision related, second is related to discomfort in the eye, and third is redness and pain which occurs after completing the course of medication. Now let us see them one by one. Vision related issues can be further classified into two types. One is non-improvement in the vision, second is initial improvement but later there is a decrease in the vision. There are three reasons for non-improvement in vision. Number one is corneal edema. Number two is that patient had some pre-existing optic nerve or retinal problems. Number three, patient had a condition called as lazy eye which was present before the surgery itself. Corneal edema. Now, cornea is the transparent structure of the eye. In some cases, after the cataract surgery, fluid collects in the cornea, and this condition is called as corneal edema. This leads to decrease in transparency and decrease in vision. Corneal edema can happen if the patient has a very hard cataract. So the energy needed to emulsify the cataract is very high, and that can cause corneal edema. Secondly, if the patient has inherently weak cornea, which may be because of the innermost layer of cornea called as endothelium, that also is a factor that can cause corneal edema. Thirdly, this innermost layer can get detached during the surgery, and that also can give rise to corneal edema. And fourthly, this can happen in a condition called as toxic anterior segment syndrome, where the patient's eye reacts to the surgery in such a way that there is a fluid accumulation in the cornea. Now, in the first case, the corneal edema usually improves with time. In the second cause, where there is a weak corneal layer, this may need a replacement by a donor tissue if there is no improvement beyond 3 months. When there is separation of the inner layer, that can be treated in the postoperative period with the help of air bubble or a gas, and usually these patients do very well. And for the fourth cause, this needs intensive treatment with drops and oral medications, and majority of the patients improve in this condition also. So here is an example of a patient who had corneal edema. You can see that the cornea is pretty translucent, you can hardly see any details inside, and this was because of the separation of the inner layer. We call it as DM detachment. Now the same patient underwent an air injection, and you can see the cornea has become clear because of the pressure of the air, and the layer has got reattached. So this is so we need to ascertain what is the cause, and that can be treated properly. In some patients, unexpectedly vision recovery is not proper. Why does this happen? Well, if the patient has very dense and advanced cataract, it is very difficult to do a thorough internal eye checkup. Internally, we are mainly concerned about the health of the retina, where the image is formed, and the optic nerve, which carries our image to the brain. If any of these has some issue, then the vision recovery is not as per the expectation. Second reason for this is a condition called as lazy eye or amblyopia, which means that though patient's eye structure is normal, his eye is functionally weak from birth or early childhood. So decrease in vision after initial improvement can happen if there is a fluid collection in the retina, which is called as dissatisfied macular edema, or the cornea becomes very rough and dry. This usually happens in a condition called as dry eye or because of drug toxicity. Some patients may develop a condition called as cystoid macular edema, where fluid collects in the retina. If you see the top figure, it shows the normal retinal structure, and a corresponding scan shows a normal retinal anatomy. In the second figure, there is a fluid collection in the retina, and corresponding scan shows swelling with empty spaces. Also, you can see that the contour of the retina has become convex. So this condition needs treatment with a course of drops which may continue for a period of 3 months, by which time the condition usually resolves. Now corneal surface roughening can happen. Now here we see a cornea which is seen in cobalt blue filter, and you don't see any stain. But if the same patient, if a patient who has got corneal roughening is stained with a special dye called as fluorescein and is seen in the cobalt blue filter, you can see a greenish yellow staining pattern on the cornea, and once this develops, this can affect the vision, and this can typically happen in patients because of severe dry eye development after the cataract surgery, or because of the toxicity of medication being used for the recovery from the cataract surgery. Drugs toxicity will improve with the withdrawal of that offending drug, and the patient is given liberal dosing of preservative-free lubricants, and then followed up closely, and usually they respond well to treatment, and as the cornea recovers, their vision also improves. Negative dysphotopsae is a very unique symptom. Here patients experience an arc-shaped shadow in the temporal field of vision. When clinically examined, these patients have a perfectly normal eye, and the lens is very well centered. Dr. Mashkat, a world-renowned researcher in his study, has found that negative dysphotopsia occurred in as many as 15% of the patients early on after the cataract surgery, although majority improves over time, bringing the incidence down to about 3% at 1 year. He also opined that it can occur in any type of IOL. The cause for this is essentially edge of the IOL and light interaction. Usually most of the patients report improvement with time. One can do simple measures like using a glass with thick temples or side support. This will help in blocking the light from the side and help in relieving the symptoms. Some patients may complain of seeing black spots after the cataract surgery. Why is this so? For this, we have to look at the eyeball structure. The back portion of the eye is filled by a semi-solid jelly called as vitreous body or vitreous humor. This is present between the implanted IOL and the retina. This jelly keeps changing throughout the lifetime and develops opacities within it. These are called as vitreous floaters. Patients notice them as black spots which move with the movement of the eyeball. They may not be appreciated because of the cataract and poor vision, but once the cataract is removed and the vision improves, patient starts to see them as spots. These are natural, so best is to ignore them. With time, brain will learn to ignore its presence by suppressing their images, and only when you want to see it, you will be able to see it. During the preoperative counseling, the need for glasses after cataract surgery is clearly explained to the patient. In spite of this, patients tend to compare their outcome with one of their contacts and often complain, "Doc, my friend can see everything without glasses, why can't I?" Now, it has to be understood very clearly that ability to see without glasses is a function of the IOL that has been implanted. Now, glass dependency is least when one gets a multifocal or a trifocal IOL. However, not every patient is eligible for these lenses due to various issues which are checked preoperatively. So one should be very clear about the need for glasses, especially its dependence for near activity before undergoing surgery. If need be, connect with your doctor to clarify any doubts in this regard. Next, we come to another group where patients develop discomfort in the eye, and that's mainly because of drug toxicity or dry eye related issues or non-specific pain. And these form the most common issues which cause extreme dissatisfaction in patients. Most common symptoms that the patient faces are foreign body sensation, irritation, occasional redness, burning sensation, watering, and pain. Patients develop toxicity to topical drugs after cataract surgery. In some patients, the eye surface is very sensitive, and sometimes these patients may also develop severe dryness. As a result, the toxicity of the medications cause irregularity on the ocular surface, all the symptoms that were just discussed. This condition can be managed by withdrawing the surgery-related drops and by giving preservative-free lubricants. Another common symptom is development of dry eye. This can happen in up to 30% of the patients. Now, this can be because the patient may have a pre-existing dry eye in a subclinical stage, so there were no symptoms before surgery, but various triggers can lead to its clinical manifestation after the cataract surgery. So, these triggers can be in the form of the anesthetic drops that were used, or the strong microscopic light. Then you can have the strong steroids and antibiotic drops that are used after the cataract surgery, and so these can basically convert a subclinical stage of dry eye into a clinical stage, whereby all the manifestations that we discussed, all the clinical features, symptoms that we discussed, gets manifested. Second is development of meibomian gland dysfunction or meibomitis. Now, meibomian glands are basically glands which are present in the eyelids, and it is a known fact that after cataract surgery, these glands can become inflamed, and this gives rise to meibomian gland dysfunction, and it causes instability of the tear film, leading to dry eye. The treatment of this condition usually involves giving hot foundation, lid massage, along with tear lubricants and oral medication if necessary. Along with all these treatments, a post-operative drop regime also has to be modified. Now, some patients develop inexplicable pain sensation after the cataract surgery. The reason for this can be because of cutting of the corneal nerves while making the incision during the cataract surgery. Eventually, these nerves regenerate. The symptom is this symptom is very rare, and it's called as persistent post-surgical pain. It usually persists for 3 to 6 months, and it's neurogenic in origin, and it can have risk factors like pre-existing anxiety, depression, fear of surgery, and sometimes genetic predisposition. Sometimes the pain is so severe that a neurologist's opinion is also sought, and required neurological medications is given, and usually in a period of 3 to 6 months patients improve. Redness and pain after stopping a course of medication. Now, post-operative medications that are needed are mainly steroids, which have to be given in a tapering schedule. Once the schedule gets over, usually in 4 weeks, sometimes patients can develop pain and redness. This is an indication of inflammation which was suppressed by steroids. This condition doesn't need any special treatment, just needs a little prolonged course of steroids, maybe 3 to 4 weeks more, and then it settles down. So to conclude, I would request that before jumping the gun to blame the operating surgeon for all the issues that you might be facing, analyze your problems and get it sorted with your doctor. This knowledge will help you understand the remedial action taken by your doctor and avoid developing negative thoughts about the surgical outcome. It will also help you not to lose your patience so that you allow proper time span for the resolution of this issue. Thank you for your patient hearing.